We're good? All right. Hello, good evening. Thank you for being here in person and at home. And so we're going to try to hit the critical things that we need to cover on dry eyes. There's some new information that I'm excited to share with you. So we'll go ahead and get started on that. So we're going to talk about all the things that contribute to the dry eye problem. Here on the screen we have listed some of the most common symptoms of dry eyes. I'm sure a lot of those look familiar to you. The most important ones I want to point out, down towards the bottom of the list in bold, I put visual disturbances. So visual disturbances is the first sign of dry eyes, and what that means is you can't hold a good focus. You'll be looking at your phone, looking at the computer, reading a book, and after a while it gets fuzzy and you find yourself blinking trying to clear it up, and it doesn't stay nice and crisp throughout the whole day. So as the dryness gets worse, then you start to experience the stinging and burning and gritting and redness and all the other stuff. But the fluctuating vision is the first sign of dry eyes. Okay? So who has dry eyes? Well, in the old days, like when I was first in school, they used to tell us, well, dry eyes is just something that older women get, but now we know it's not, it's men too. And we used to also be told, well, it was more as a sign of menopause, but now we know it's not. It can happen at any age. Even young folks get dry eyes. In fact, some of the more severe dry eye cases are teenagers who are staring at their phones for hours at a time, and then people working on computers for hours. They forget to blink, the eye dries up, things get fuzzy, they get irritated. So the demographics of who has dry eyes has evolved as we continue to learn more about this disease. So what are some of the causes of dry eye? So certainly the first thing on the list is medication. So medications is not just oral medications, but also eye drop medications. And even stuff that you take over the counter is still considered a medication. For example, some of the things that cause dry eyes are over the counter allergy medicines like Zyrtec and Claritin and Sudafed. And then of course prescription medicines, especially medicines for blood pressure, anxiety medications, pain medicines, muscle relaxants, medicines for attention deficit disorder. Many medications will have dry eyes as a side effect. Eye medicines that we use, especially for glaucoma, can also induce a little bit of dryness in the eye as well. So there's many different sources of medicines that can influence the tear film on the surface of the eye. Hormonal factors is a factor in dry eyes. That's why it does happen more as we get older, and more so in women as menopause occurs. But hormonal changes occur in men too. As you drive around town, you see signs advertising to be tested for low testosterone, because as your testosterone goes down for men and for women, your dryness does get worse. Other factors are if there's any inflammatory condition in your body. Patients who have rheumatoid arthritis, Sjogren's, lupus, things like that are going to have more inflammation in their body, and those inflammatory cells attack the tear glands and shut down some of the tear production. So that's a factor as well. Diet and hydration. None of us really probably drink enough water as much as we should. If you're chronically dehydrated, your eyes, of course, are going to be more dry as well. One of the things that I kind of alluded to a while ago was the blinking. So on the computer, people don't realize that they blink 60% less frequently. They just stare. And when you don't blink, you don't make tears. The other thing that happens is they don't make full blinks. They tend to only blink part way. And only when the lids touch will it squirt tears onto your eye. So it has to be full closure every time you blink. So full and frequent blinks is critical. That's a really common problem with people that work on computers all day. But even again, as we said, now even in teenagers who are staring at their phones for long periods of time. So neurotrophic keratitis is on the list. Now that's a really interesting condition. We're going to talk a little bit more about that in a minute. But neurotrophic keratitis is damage to the corneal nerves. Your corneal nerves sense pain, they sense temperature, and they sense dryness. But when there's been damage to the nerves, the eye does not sense dryness like it normally would, because when it feels dry, it'll trigger your brain to produce tear flow. But if those nerves have been damaged in any way, your eye doesn't realize it's dry, and it doesn't produce tears like it's supposed to until the eye gets severely irritated, and then it's painful. But we'd rather the eye be able to maintain its moisture throughout the whole day. Environment is a factor. especially in the summer or even in the winter. If you have that ceiling fan blowing, it's blowing air across the surface, it dries up quicker. If you're outside and it's real windy, it's going to dry up faster. If you're flying in an airplane, it's extremely dry inside the airliner so that they don't develop mold inside the cabin. They use dehumidifiers, so there's very little moisture. If you travel to a very dry climate like Arizona, it's going to also make your eyes more dry. So the humidity and the moisture in the air is a factor as well. Contact lenses also cause more dryness because the contacts suck up a lot of moisture off the surface. So a patient who has a mild case of dry eye is going to get a lot worse when they try to wear contact lenses. The Demodex, we're going to talk about in a minute. The sleep deprivation apnea is when you're asleep and your eyes are nicely shut like they're supposed to be, the surface of the eye will repair any injuries or irritation that's occurred during the day from any dust or dirt that's in the environment. So if you're not getting enough sleep, or if your eyes are not maintaining full closure, then the eye cannot repair the skin on the surface, so the dryness and irritation just gets worse and worse. So that's the time the eye has to heal. Okay? Smoking, when you smoke, whether it's yours or other smoke, it produces nicotinic acid. The acid in the air, the smoke in the air, stings and burns and irritates the surface of the eye, so that's also a factor. And then, of course, face masks. When you have the mask and you exhale, it blows air across the surface just like a ceiling fan, and it just dries the air up on the surface of the eye. The tears dry up faster. Okay? I put a few others at the bottom here. I'm not going to go specifically into those, but if you have questions about those, let me know. I can address that, but I was really wanting to touch on the primary factors that all contribute to the dry eye. Okay? All right, so what are some of the main points to remember about dry eye? So there's 4 main things to remember. Number 1, again, if you're not making full and frequent blinks, you won't squirt tears and the eye will be dry. Number 2, if there's inflammation, whether it's from your own body or from external irritants, the inflammation shuts down the tear production. Okay? Number 3, excuse me, if the glands in the tears, if the tear glands in the lids are clogged up, the tears can't get through. You can accumulate dried mucus, dead skin cells, crud clogs up the glands, and the tears can't get through that. And then lastly is, as I mentioned a while ago, any damage to the corneal nerves is going to also prevent your eye from producing natural tear flow. Okay? All right. So, what about the tears? Why do we even have the tears? What's the purpose of it? Okay? So, number 1, they lubricate the surface so that when you blink, your eyelid just glides on the tears. If you don't have enough tears, your eyelid literally scrapes over the surface. It's kind of like in your car. If you don't have enough oil, the metal just grinds on itself. Not supposed to. It's supposed to slide on that tear film. Okay? Also, the tear film helps you to stabilize and maintain good, sharp vision, like we talked about a while ago. The first sign of dry eyes, you can't hold a good focus. Okay? All right. Also, the tears contain nutrients, and they contain proteins, minerals, oils, everything that the eye needs, oxygen to maintain itself. The cornea, the front of your eyeball, the cornea, is unique in your body. It's the only part of your body that does not get its oxygen and nutrients through the blood flow. It gets it directly out of the air. So they transfer that through the tear film. So if you don't have good tears, you're not going to get enough nutrition to the cornea. Okay? And then lastly, the tear film has enzymes which help to kill bacteria and viruses to prevent infection. Also helps to dilute allergens. That means whether it's cedar or oak or ragweed, whatever's in the air, anything that gets into your eye is going to irritate you. If you have a good healthy tear film, it'll dilute the tears and wash all that crud away so it doesn't irritate your eye. So if you don't have a good tear film, you're going to have much more problems with the dry eyes. So one of the worst cases, patients always say, what's the worst thing that can happen with this dry eye? The worst thing that can happen is what's called a corneal ulcer. So a corneal ulcer is when the surface of the eye has been so dry and it's literally like scraped up and you're missing some of the top layer of skin. Then the bacteria, which are present on the eye, on your body all the time, there's bacteria. Those bacteria will get in through that opening and invade the cornea and cause an ulcer. Ulcers are very dangerous. You can literally go blind from an ulcer within a day or two. Very, very serious, very, very painful. So worst case is a corneal ulcer. That's what we don't want. Okay? All right. So we talk about the tears. when we use artificial tears, like to wet the surface, it does help you feel better because it has some lubricant and some saline, some moisture in there. But it's not the same as your own natural tears because, again, as we said before, your natural tears contains the oils, the minerals, the enzymes that are not present in the, quote, artificial tears. So our goal, in other words, is to improve your own natural tear production because it's better than what you can get out of a bottle. Okay? All right. Now, there's two main types of tear production. There's the tear production that you're doing right now as you sit there. It's called your basal tear production, just as you're relaxed throughout the day, blinking in a normal manner. And those are the tears that contain the enzymes and the oils and the minerals, all the good things we want. There's another type of tear called reflex tear. A reflex tear is what your eye produces in response to some stimulus. For example, if you're cutting onions, okay, and the fumes get up in your eye, they burn and irritate it, and your eye will tear to wash that away. Or if you're seeing a sad movie, it triggers that tear response, right? Or you get an eyelash in your eye, and it triggers that tearing response to flush that away. Those tears are not the tears that we want throughout the day because those reflex tears are mostly salt and water. They don't contain the enzymes and lubricants and everything that you need throughout the day. So I point that out because patients will say, well, sometimes I can just cry, like anytime I see a sad movie, I cry. So that must mean I don't have dry eyes. No, it's a whole different type of tear, and it's a whole different tear system. Okay? All right. Now, again, there's two main things that cause your eyes to be dry. One is if you don't have enough oil. The other is if you don't have enough water. In the old days, we used to think if you're dry, it's because you don't have enough water, because the tears are mostly water. If we actually look at a layer of tears, there's, let me go back, let me see if I can go forward. Nope. Yeah, so if we look at the tear film on the front of the eyeball, the outermost layer on the front is oil, a very thin layer of oil called lipid. Then below that's a thick layer of water. And at the very bottom is a very thin layer of oil called mucin. So it's mostly water. And so in the old days, we thought, well, if you have dry eyes, it's because you don't have enough water. Well, newer studies show that 80% of the time, it's not the lack of the water, it's the lack of oil that's not working properly to hold the tears on your eye. If you don't have the oil, the water just evaporates and just drains away. With the oil, it holds that moisture on the eye like it's supposed to. Right? Now, I kind of jumped forward. Let me go back. All right, so in this diagram, in the upper left corner, you see this kind of yellow, spongy looking thing. That's what's called the main lacrimal gland. That's the one that produces the water and the salt. So that's the one that flushes the eye when there's something in there. Okay? In the lid, you have about 20 to 25 what are called meibomian glands in the bottom lid and in the top lid. There's these tiny little glands that squirt out oil, all the lubricants. Every time you blink, squirts them out. And we're going to see a video about that here in just a second. Okay? So there's two different tear glands, two different tear systems at work. Now, after you blink and make tears, where do the tears go? Some of them evaporate, but most of them drain out through the little drainage canal in the corner. You have an upper and lower drainage canal. That's where the tears drain away. From here, they drain down to your nose and down to your throat. That's why when you cry, your nose runs and you cough because all the tears are flooding down to your throat. Okay? And similarly, some of the medicines that we use to treat dry eyes, they drain down there and patients will say, oh, it tastes kind of funny. Yeah, that's the natural drainage system. Now, on the other side of that is we can sometimes help the dryness if we temporarily block up that drainage canal so that you don't lose the moisture so fast. Those are called punctal plugs. We're going to talk a little bit more about that in a second. But this gives you kind of a good overview of the tear system. Again, the tears are produced in the lids and in the gland under the lid, and they drain out through the corner. All right. We already talked about that. Okay, so we're going to run a video here in a second. I want you to pay attention to a couple things. One is the patient is making nice, full, complete blinks. And when they do blink, you'll see a little bit of oil squirt out. And then when they open, it's going to spread that tear film across the surface. The oil in those tear glands should be clear and slippery, like silky smooth, not thick and sticky and gooey. So go ahead and run it. So you'll see a nice blink. And you can see that oily film on the front surface of the eye. That's beautiful. This is exactly what we would like to see. Full blinks, a nice thin layer of tears, slippery oil, not sticky and gooey or anything like that. Okay? So that's what we want to achieve. Now, the glands I mentioned that are in the lids open up right on the inner edge of the lid, right inside here, and on the top as well. So you have about 20 to 25 of these little openings in the top lid too. And when the doctor looks at you through the microscope, we can see if those openings are nice and full of clear oil, or if they're clogged up with goo. And if they've been clogged up a long time, they'll actually seal shut and the gland will scar and just die away. It'll just deteriorate. So in this picture, if we follow the edge of this lid, you can see these nice pink little round openings, nice beautiful oil in the glands, compared to the picture down in the middle is the one we just looked at. That's nice. But up here in this top left corner, one, you don't see the openings very easily. You can't even tell where the glands are. It's all scarred over. Two, you see all these squiggly red lines. Those are what we call vascularization or neovascularization. They're abnormal blood vessels that grew on the surface because of long-term inflammation. They're not supposed to be there. Also, in this bottom picture, the normal eye, there's nice thick eyelashes. So all the lashes are thick, they all grow down like this. But in that top left corner, you can see there's some areas that have no lashes at all, and they're growing in all different directions. So that's what we call broken and misdirected lashes. And when you lose the lashes from chronic inflammation and infection in those glands, that's called matarosis, then you have the loss of lashes. And patients will come in, they'll say, yeah, I've been losing my lashes for a long time. Well, that tells us that they've had this long-term problem in those glands in the lids. Okay. Now, it's a little bit hard to see this scale, but basically, this is an infrared picture of those tear glands I'm talking about that are in the lid. They should look like that first picture here on the left. They're long, stringy-looking glands. Okay. Now, when the eye is nice and healthy, every time you blink, it squirts the tears. But when the glands have been blocked up or inflamed for a long time, it seals shut and the gland dies away. And the other pictures here on this top right, you can see there's a lot of dark area. Just the tip of the gland is remaining. So the glands have scarred away and just died, and now it's just dark space with no more gland. The bad news is those do not regenerate. That damage is permanent. So we don't want to see a lot of loss of gland tissue because they won't come back later. And we take this picture when we're doing dry eye evaluations because only 5 clinics in the city have this infrared camera. And this gives us a lot of good information. So at some point during that process, we get this picture to see what we're dealing with. Now, remember I said how the oil in those glands should be clear and slippery. Well, we've known for a long time that if those glands are full of dried mucus and dead skin cells, that not only do you not get the tears through, but the glands themselves can actually get infected. And then they start secreting this kind of sticky, pussy stuff. So oftentimes patients will say, yeah, when I wake up in the morning, I have this kind of crusty, gooey stuff on my lids. That's dried pus. Well, we knew if we could get all that sludge out of there, all that crud out, then the glands would work better. They'd have better tear flow. So in the old days, we used to do a procedure called dry expression. We would use these little, kind of like little clamps, and just squeeze the heck out of your lid. Okay? And we could force out some of that goo. It's extremely uncomfortable for the patient. It takes a lot of pressure. It takes, almost 30 pounds per square inch of pressure. That's almost like as much as your tire pressure. It's a lot of pressure to squeeze that goo out of there. Patients hated it. It helped them, but they almost never wanted us to repeat it because it's so uncomfortable. So that was the old days. So I'll let you see this video for what we're talking about. So you can see the little clamps here. See that gooey, gunky stuff coming out of there? That's what we want to get out of the gland. All that crud does not help your tears. It blocks the tears, and it has a lot of bacteria and toxins from the bacteria that sting and burn the eye. So our goal is to get all that sludge out of there. Open up the glands. Okay? All right. Well, you get the idea. You don't have to see it over and over. You get the idea. All right. So let me go to the next one. So how does this occur? So again, the glands get blocked, and so therefore you don't have enough oil. The tears dry up. They get inflamed. They get irritated, and then all the symptoms begin. Okay. Now, one of the things that can happen when the glands have been blocked up a long time is that dried mucus and crud that's in those glands becomes a breeding ground for a little infestation of a critter called Demodex. Demodex is kind of like a dust mite. And that dust mite lives on the dried mucus and dead skin cells in those glands. And people sometimes think it's just what we call blepharitis, like a common infection, but it's not. It's an actual infestation of these little mites. And in the old days, we used to clean the lids with shampoo and stuff to try to kill it. It doesn't get rid of them. The only thing that will kill this Demodex mites is tea tree oil, or the active ingredient in tea tree oil called terpenol. And so now there are lid cleansers made specifically for that. So if the doctor sees evidence of this, we'll use a different lid cleanser in order to kill those little critters. It's actually fairly common. Studies show that 50% of 50-year-olds have some Demodex in their glands of their lids. 75% of 70-year-olds. So it's really common. Okay? It's more so in men, but that's because men don't clean their lids like the ladies do. When ladies remove your makeup, in the process of removing your makeup, okay, you clean and you wipe away a lot of that crud. Men don't do that. So we have more problems with Demodex with men, but it happens in ladies too. Especially, and we're going to talk about this in a second, especially if you're wearing the lash extensions, you know, the false eyelashes, because then they don't clean their lids because they don't want to wipe off their lashes. So as a result, that crud builds and these little critters start to grow. Okay? All right, so again, cleaning the lids. In the old days, it was baby shampoo. When I was in school, that's what we told everybody. Well, the problem is, and we blew this up here, and you know, the ingredients, it's PEG 30, sorbitol, I can't even read all these. It's a bunch of chemicals that none of it sounds like it's good for your eye. Baby shampoo has a lot of chemicals in there, fragrance, coloring. Your eyes don't need any of that. So then, about 15 years ago, they came out with what are called this OcuSoft lid scrub, the one in this dark blue box. And that is still around. It's a good cleanser. It's a very, very diluted soap. And you use that to clean the lids. And that works good for a lot of folks. But it does not kill the Demodex. The only ones that will kill the Demodex are these other two. The one on the right says Oust, the one on the bottom called Blefadex, and there's another new one called Optase. Those are either tea tree oil or the refined tea tree oil, and that's what kills the Demodex. So if the doctor sees that, we'll use one of these cleansers first, and then sometimes switch you to this other one for maintenance, okay? All right, lastly, yes ma'am?
The tea tree oil, what about just using the straight tea tree oil?
So yeah, that's a good question. So, you know, you can buy tea tree oil at some, you know, like Whole Foods or whatever. The problem is that's not purified. It can have contaminants, it can have, you know, who knows what's in it. Whereas these are pharmaceutical grade, they're pure. Any contaminants have been removed. So that's a good question. And also the stuff in the tea tree oil that you buy at the store, you don't really know how concentrated it is, or, and again, if there's any impurities. Okay? All right. Now, the one at the very top, Avanova, is a really neat solution. That's a lid cleanser. That's a lid disinfectant. That is what's called hypochlorous acid. That is for people who have chronic infection. It kills bacteria on contact. It's actually a skin disinfectant. So if we have somebody who we see a lot of infectious component to their eyelid, then we'll use that ongoing to keep the bacteria from overgrowing. So depending on what we see at the exam through the microscope, we'll determine what lid cleanser is best for that particular situation. Okay? But baby shampoo, no. That's like using leeches. That's no good. Okay? All right. So besides the medicines and treatments we're going to talk about, there's some just helpful hints that I wrote down, and these are something that you should really look at doing, okay? And so one of them is, if a person does have glaucoma and we're treating them for glaucoma, every medicine that we put in the eye with glaucoma generally has a preservative. The preservative is to prevent the medicine from getting contaminated. But those preservatives can irritate the eye. And some of the medicines for glaucoma patients have a reaction to. Well, now there is a company that can make preservative-free glaucoma medication. Okay? So if you're being treated for glaucoma and you have dry eyes, we can ask your doctor about, will that be something that would benefit me? Also, there are laser treatments for glaucoma. There's surgeries for glaucoma. So there's other ways to get around having to use drops that have preservatives in them. Okay? Most people don't have trouble, but for few people that are sensitive to the preservative, there are other alternatives. Right? All right, lifestyle changes. So this is a real big one. We talked a little bit about blood pressure medications, anxiety medications causing dryness in the eye, right? Well, of course, if you have a healthy lifestyle, a healthy way to manage the stress and not have to have the blood pressure medicine, and not have to be on the anxiety medications, you're going to have less trouble with the dryness, right? So, diet, exercise, all of those things that we hear about all the time, it really does make a difference. Taking breaks from the computer. So somebody who works on a computer all day long, when they get their lunch break, I tell them, don't go check your emails or your Facebook or whatever. Get away from the computer entirely. Go do something different. Walk around, look outside, let your eyes rest so they're not always looking at that one spot, so that you can kind of blink in a more normal manner. There are little apps that you can put on your phone that will remind you to blink. Because again, when staring at the computer, people literally forget to blink. Okay? All right. Washing and drying your bedding on high heat will help kill the dust mites, because they can irritate your eye, right? Also, air purifiers, you can run those continuously. We have one in our bedroom. It just runs all the time, just to keep any dust and dirt from being in the air overnight that we're breathing, right? Good quality sunglasses, really important. All the sun beating down on your eye causes the lid skin to get real thick and more scarring. It's like if you see somebody that's a rancher or a farmer, you can tell the skin on the back of their neck is real thickened, almost like leather. The same thing happens with the delicate lid skin. It can get real thickened and scarred over because of the sun beating down on it all the time. Okay? So good sunglasses and a hat, preferably both. Right? A good seal around the face mask to stop the air from escaping. Right? The best seal is to put a little piece of surgical tape across here. Now, it's not easy to take on and off, but if you're going to leave the mask on for a long period of time, that works really well. Okay. All right. Also, we talked about the eyelash extensions. There is a medication called Latisse. That's by prescription, and that helps the natural eyelashes to grow longer and thicker. So if we can get your own lashes to start growing thicker and longer, you won't have to do the extensions, and then you can clean the lids in a normal manner so they won't be so dirty and full of grime and bacteria. Okay? And lastly, if you've noticed, if you take a shower and you get out of the shower and your eyes are really red, it's because a little bit of water or soap or something is getting through when you shower. So put an artificial tear in before you shower, before you wash your face. That kind of protects the eye from any crud that gets in there and kind of dilutes any soap or anything that might get washed into your eye. Okay? Right. So I'm just going to point out one thing out of all this slide, and that is the two top left pictures. We put a dye in the eye called fluorescein. It's a yellowish orange dye. We put a blue light on it. You see that blue light, and then it glows. Basically, it lets us see three things. It lets us see if there's any dry areas. It lets us see if there's any dead skin on the surface of the eye, whether it's an abrasion or an infection or an injury. And it lets us see the actual tears flow as you blink. Okay? So that lets us see what's happening as you blink throughout the day. The tears are being produced, and we can see them flow on the surface. Now, again, we talked a little bit about inflammation being one of the causes of dry eye. So where does the inflammation come from? It can come from external irritants, right? Cedar, oak pollen, cats, whatever you're allergic to that's in the air. It can also come from food you ingest. Like if somebody has a peanut allergy or a gluten sensitivity, right? They ingest that food and their body reacts against it. It causes inflammation. Thirdly, if there's inflammation in your body because of some infection or autoimmune condition. So all three of those sources of inflammation will cause problems with dry eyes. Right. Now, point we need to make is the dry eye can be treated, but it needs to continue to be treated because it's a chronic condition. I tell patients, think of it like arthritis. You can't cure it, but you can treat it. You can get it better, but you have to continue to be treating it. Otherwise, it will get worse. All right. Now, and another thing that's very characteristic of dry eyes is not only is it chronic, but it's going to have its flare-ups. It's common for it to be okay, and then it gets worse. What makes it get worse? It can be stuff in the environment. It can be changes in your diet, changes in your medication. Something causes it to flare up. That's common. So I tell patients, don't get frustrated. There's going to be those times when it gets worse, and there are medicines we can use to calm those inflammatory episodes. There's a really good one called Isovis. I think it's in here. Anyway, we'll come back to it. That's made just for inflammation. All right? All right. Another thing that's really important to know is any kind of chronic condition, like dry eyes, arthritis, these types of things, has a really high incidence of depression. That's really important to be aware of that, especially for the family members of the patient who's suffering with the dry eyes, to be supportive, but also for the patient themselves not to isolate themselves, because it's easy to do that. There was a study at the VA where they had patients that had brain injuries and PTSD, had a big increase in dry eyes for that reason. They would isolate themselves, and some of the medications that they would take would make the dryness much, much worse. And it's a downward cycle. The more depressed a person is, the more medicine they take, makes the eye more dry, which makes them more depressed. So it's kind of a downward cycle. So what do we do? Obviously, seek counseling from a mental health professional. Extremely important, social interactions, not to be isolated, right? Do things that are going to get you to be with other people, and anything that you do here that helps to improve your demeanor, reduce your depression, will reduce the need for the medications, because again, those make the eye more dry. If you need them, you take them, but do the other stuff too, right? All right. So I mentioned briefly about plugs. Again, plugs are the little insert we put in the corner. It's FDA approved, it's safe, it's painless. There's two kinds. The most common type we use dissolves in about 4 or 5 months, and there's also one that doesn't dissolve, called permanent. We typically do the temporary ones, the dissolvable ones, because you don't feel them. But the key thing to understand on these is, again, the plugs go here in the corner. The key thing to understand about plugs is that, tell me to stop. Yeah. The plugs are like fixing a crack on your wall. If you have a crack on the wall, you can patch it up, but you didn't really fix the problem. You think it looks better, but the problem's still there, right? You still got to fix your foundation. That's the same thing with plugs. Plugs can give you some symptomatic relief, and I'm all for helping patients feel better, but you still have to address the root cause of the problem, which is what? You're not producing enough tears, so we still have to do that, okay? So plugs are good. I do them to help have patients get a little bit of relief. It improves the effect of the medicine, but you still have to treat the root cause of the problem. All right. Now, medications. There's a lot of medications that we can use to treat dry eyes. Obviously, the most common thing we start with is the artificial tears, the wetting drops. And it does give you some brief momentary relief, right? But again, it gives you the relief, but it doesn't fix the problem. We still have to address the underlying cause, right? Once we get the inflammation under control, which we typically do by using a steroid for a week or two, calm it down, then we switch it to a maintenance medicine. The most common ones are Restasis and Xiidra. There's another similar one called Cequa, and those are for ongoing use to keep the inflammation under control. If a patient does not have a good response with those, we can also use others in that same family with the Restasis and Xiidra called NSAIDs, non-steroidal anti-inflammatory drugs. There's Bromfenac, there's Nevanac, there's others as well, and those can work quite well for the inflammation for the dry eyes. Sometimes we'll also use an oral antibiotic, doxycycline. It works really well because it reduces inflammation. It helps a lot for the dry eye symptoms, especially if they're having a lot of styes. We'll use that. Oral supplements is really, really important. We talked about Restasis. There was a study that had one group of patients took Restasis for 3 months. Another group of patients took a good quality omega-3 supplement for 3 months. At the end of the 3 months, they both had the same improvement. So it's a very, very beneficial. I'm not against Restasis. I prescribe a ton of Restasis and Xiidra, but I also want people to be on omega-3s because of the anti-inflammatory effect. So does turmeric, curcumin. So all of those oral supplements can be really helpful to keep the inflammation part of the dry eye under control. Okay? There's also oral medications for patients who have a condition called Sjogren's syndrome. Sjogren's is an inflammatory disease that affects the tear glands and the salivary glands. And there are medicines that can be prescribed that can help you produce more tears and more saliva for their dry mouth. Okay? Those are prescribed by a rheumatologist. All right. Autologous serum tears. So autologous serum tears we still use, not as much because we have some other options that I think are even better. But autologous serum tears are interesting. What they are is we send a patient to the blood bank here down I-10. They draw the blood, spin it in a centrifuge, and the red blood cells fall to the bottom of the tube, and the clear serum stays on top. They take the clear serum, mix it with saline, and give it back to the patient in these little bottles. So the good news is we know you won't be allergic to it because it's your own actual blood product. They're sterile. There's no preservative in it. It can help a lot of patients because there are some beneficial nutrients that are in the serum. The downside of it is you have to keep going back to get your blood drawn, okay? And you have to keep the little bottles cool, refrigerated, and not covered by insurance. And if you have a lot of inflammation in your body, some of those inflammatory cells will still be present in the serum. So it may or may not help the patient. It's kind of on a case-by-case basis, okay? All right. Isovis, I mentioned that briefly ago, and what that is a mild steroid to calm the flare-ups. Again, it's a chronic problem, but there will be flare-ups. When that happens, we use these mild steroids like Isovis to calm that inflammation. Our clinic actually did the clinical study to get Isovis approved by the FDA, so we've been working with that medicine for a long time. It's a good medication, okay? Tyrvaya. Tyrvaya is literally something that's just approved by the FDA in the last 2 weeks. Very new. So I have a sample of it here. I'll open it. If anybody here in the office wants to take it, you can take it with you. But I'll show you what it is. It's kind of interesting. It is a nasal spray that helps to produce tear production. So here's a sample. It kind of looks like the, Flonase you can buy at the store, which used to be prescription. So you take the cap off, you prime it a few times, and you just put a squirt, and then in the other nostril a squirt. And what it does is it stimulates the nerve that leads from your nose to your brain, and it triggers the eye to produce tears. Okay? It's pretty cool. I've used it myself. It does work. Some people do really well with it. Other people, does not for them. Okay. Well, but it is something new. I wanted to show that to you, called Tyrvaya. And that was literally just approved in the last 2 weeks. Right? All right. Another one is Lumify and Upneek. We'll talk about that in a minute. Oxervate, Regeneron, we can talk about. Now, I'll put some at the bottom here that are medicines that are not yet FDA approved, but I think may in the future have some benefit. One is castor oil. It's a good lubricant, but again, it has to be a purified form, and it's not yet FDA approved. There's some under study, so maybe more to come on that, okay? Genesis Tears, it's another one under study. Carnitine is an amino acid, and at the bottom, it barely you can see is a CBD oil. So all of these are not FDA approved for dry eyes. Maybe in the future, we'll see. But all the stuff that's up above here are all approved, and it's stuff that we use on a regular basis. Okay? All right. All right, now, as far as other ways to treat the dry eye, we talked about the blinking exercises, also a warming mask. The warming mask, you put it in the microwave to warm it, close your eyes, lay it on there. What the warming does is it helps to melt the mucus that's clogged up in the glands so that it will drain out. We want to get that crud out of those glands, unblock them. So we do the warming mask, and then we clean the lids with one of those cleansers that we discussed, okay? All right. If the eyes are still dry and we do plugs, but patients say, hey, the plugs did help, but they keep falling out, there is a way to actually cauterize or like burn shut the little tear duct. We don't do it a lot because if we ever have too much tearing, you can't reverse it. Whereas the plugs, the nice thing about the plugs, you can remove them and they'll dissolve by themselves anyway. But that is another treatment option, and that's what it's doing. Okay. Moisture chamber goggles. Moisture chamber goggles are basically like swim goggles. They're little goggles that have a little rubber seal, just like a swim mask or a swim goggle. And those are for patients who are severely dry. They oftentimes will use those, for example, if they travel, again, to the desert, where it's super dry, it creates like a little moisture chamber, like a humidity, okay, inside that little chamber. And that can get people through a rough spot. Obviously, they're not attractive, they're not what you want to wear all the time, but if you're really suffering, that can be helpful. All right. And these other ones we're going to talk about here in a minute. There's other treatments down here that are not as effective or are not yet FDA approved. If you have questions about any of these, let me know. I will point out one thing because it's kind of interesting, is acupuncture. There was one study done in South Korea on acupuncture, and it showed that it was beneficial for dry eyes, but it was not a very well-run study. As you all probably know, we do a lot of clinical studies here at MCOA. A lot of the medicines I've talked about here, we actually did the studies on, but we only do what's called a double-blind masked study. And what that means basically is the doctor doesn't know who's getting treated, and the patient doesn't know whether they're getting treated or getting a placebo, so we know if it's really effective. that study on the acupuncture, the doctor did the treatment and he evaluated the patient. So that's not really a good, valid study. But anyway, I put it in there because it's kind of an interesting thing people will sometimes ask about. Okay? All right. If you have any other questions about these, let me know and I can address those. All right, now, ProCare. So let's talk a little bit about this. So when I showed you those pretty colored pictures, I showed you where the yellow was glowing. It was dry, dead skin on the surface of the eye. When it gets severely dry, I tell patients it's almost like chapped lips. The skin is rough and dry and scaly. So we do these treatments we talked about to help to produce tears, which generally will heal that dry, dead skin. But sometimes that skin just refuses to heal. Well, then we use this other series of treatments. The most well-known one is called ProCare. ProCare is really interesting. It's a contact lens made out of human amniotic membrane. So from a full-term healthy baby, they save the placenta, use the inside lining called the amnion, make it into a contact lens. The doctor puts it on the eye like a contact lens. It stays in there for 3 or 4 or 5 days. During that time, that amniotic membrane has the stem cells and growth factors the baby needs to grow healthy new skin and cells rapidly. When we put it on the eye, it super accelerates the healing of that dry, dead skin. Also helps to regenerate the corneal nerves. So when we remove it a few days later, that skin is beautiful and smooth. It's just beautiful to see. Okay? I'll show you a picture of what we're talking about. So these are the times that we use the ProCare. Again, the dry eyes, ulcers, abrasions, but and corneal nerve regeneration. So I'll give you a better picture of it here. So on the top left, you can see this pupil area is real rough and scaly. It looks almost like the surface of a coconut. It's all roughed up. After we do the treatment, we put the ProCare, and here on the top right, the ProCare is on the eye, and in the bottom left, we remove it. Now you can see the surface is nice and smooth. Big difference. So imagine if you were the patient trying to look through this top one, everything looks fuzzy because you're seeing all hazy. The bottom one, now their vision is much improved because the surface is smooth again. Okay? Right. Here's another before and after. Top before and the bottom after. Okay? You can see it's all hazy here in the pupil area. Now nice and crisp. When we put the lens on, this top right picture, it's clear. It looks kind of like wax paper, but as it sits on the eye absorbs the nutrients and the lens absorbs the dead skin cells and all the crud out of the tissue. So the lens starts to turn kind of hazy here at the bottom when we remove it a few days later. So that's called ProCare. So it's a human amniotic membrane. Now, some people don't tolerate that lens well. If so, there's a dehydrated version of it, and there's different companies that make it. The one we use the most is called Eclipse. So you can see this looks like a little wafer, this little disc. It's the same amniotic membrane, but it's dehydrated. Okay? It's like a dehydrated piece of fruit versus the real fruit, right? So this little dehydrated one, we can also put on the eye, put a soft contact lens on top of it, and it has the same effect as far as the healing properties. It's not as beneficial as the original wet ProCare, but it's still helpful. Okay? So that's another option, a dehydrated amniotic membrane. Now, if a patient is still not doing well, or they want something they can use ongoing at home, there is now a liquefied version of the ProCare. So this is a liquefied amniotic membrane. So basically think of it like it's a fruit versus fruit juice, right? So this is the liquefied version. You just apply at home 4 times a day. Excellent, excellent medicine. This is made by a company called Regeneron. It's called Regenerize, made by Regeneron. Regeneron is the company that made the monoclonal antibodies that President Trump and our governor was treated with when they had COVID. So they're a very advanced biological company. Okay? This treatment, only by prescription, is not covered by insurance, okay? But it has excellent results. I have many patients that use it ongoing because of the extra nutrition it provides to the eye. So again, it has the stem cells and growth factors that the original membrane has, but it's a liquid version that you apply at home by prescription. Now, in some cases, a patient still isn't healing. They get better but still not healed. Well, then we bring out the big guns. The big guns is called Oxervate. Oxervate is a lab-created version of the same growth factors that are in the amniotic membrane. So this one is about 10 times more powerful than the original membrane. Okay? Amazing, amazing medicine. It can not only heal all that skin, but it also helps to heal those nerves, which again is part of the problem. The corneal nerves can be damaged both from surgery, like especially LASIK surgery. It can also be damaged in patients who are diabetic. You know how diabetics get foot ulcers because they have that neuropathy, right? The nerves aren't functioning. It can also be damaged if you've had recurring infections on the surface of the eye, chemical burns, various causes. So regenerating those corneal nerves is a huge, huge breakthrough that we didn't used to think was possible. This is only stuff that we've been able to do for the last couple years. Before we thought, well, the nerve's dead, it's gone forever. Now we know there is a way to restore that nerve function. It's really, really important. The oxygenate is a great medicine. The only considerations are, number one, insurance does cover that, but we have to get pre-approval because the medicine is about $25,000 per eye. So as you would imagine, the insurance is not going to want to pay for that until you can show them you've tried everything else first. Okay? But it does have great results. All right. All right. Now, we talked a little bit about the Isovis. This is that medicine that we use when there's a flare-up. It's a mild steroid, calms the inflammation. Not to use all year, but whenever there's a flare-up, it works well. This is the one that we did the study on. Okay? Tirvea, I just showed you. That's the nose spray one. Right? Now, again, we want to get to the real cause of the dry eyes. We know what those things are. We talked about that before. There are ways we can address the root causes of the problems. One of the things that can cause the dryness is when the glands not only are clogged up, but they're covered with crud. Dead skin cells, dried mucus, crud can accumulate right on the edge of the lid where we said the glands are, right here on the edges. And all that crud forms like a crust, and the tears can't get through that. So it's similar to on your heel of your foot. You get that dry, dead skin, it's like a hard, real stiff, you know, and you can wash it, but the only way to get rid of it, you have to like scrape it off, right? So there is a device, it's an eye instrument that we use in the office called Blefex, and you can see it here on the right. The tip is a sterile sponge that spins real fast. And what we do is we use it to polish all that crust off the surface of the lids so that the glands are not covered up with that crust anymore. Okay? Here's a little video of the treatment. We put a numbing drop and the patient looks up and we just polish that inner edge of the lid. Polishes all that crusty stuff away. It's actually really gentle. It doesn't hurt at all. It just tickles. I tell patients it's kind of like an electric toothbrush. If you touch the electric toothbrush to your lip, you feel the little vibration, but it doesn't hurt. That's what it does. So this polishes all the crust away. So that's step one, clear the surface, get the crust off, okay? All right. Then the next step is to flush out the sludge that's inside the glands. So we do that with either LipiFlow or Tear Care. And I'll show you what those are here in just a second. So the LipiFlow is an eyepiece that the doctor places on your eye, kind of like a contact lens. And the contact lens that's under the lid warms up to melt the dried mucus. So it liquefies all the crud. The front part has two little soft cushions that massage. So it does it simultaneously. So we put a numbing drop, place the eyepiece on there, you close your eyes, you just relax. It takes 12 minutes. It warms, massages, warms and massages simultaneously. It extracts all the crud out of there so it's not full of that sludge anymore. That way, when you blink, the tears can get through onto the surface of the eye. Okay? It takes 12 minutes. We typically do both eyes together, but we can do them one at a time if the patient wants to. Here's a video of putting that little eyepiece in. Again, we put a numbing drop. Oh, here we go. There we go. So we put a numbing drop, just have the patient look down, slide it up under the top lid, and they look up, pull the bottom lid, and it's on. That's it.
Is that covered by insurance?
This one's not covered by insurance.
It is?
Is not. Yeah, yeah. So, and then we put a little piece of tape to hold the little cord out of the way. Sometimes I'll put another little piece of tape on the bottom, but that's it. It takes like, 30 seconds to put it on, and then we just run that treatment for 12 minutes. Then we take it out, and all the tears now can flow. They're not full of sludge anymore. Simple. That's called LipiFlow. Okay? Now, This is a picture of it, the little eyepiece, and you can see the clear white part looks like a contact lens. So I'm going to skip over this. This is a study that shows the effectiveness of it. We're going to skip over a little bit of this. Whoops. Okay, so is it safe? That's important to know. So the globe is what we call the eyeball. The eyeball is protected from the heat. So in other words, the warming goes into the lids, but none of the warming goes into your eye. Just the lid gets the warming. Okay? Also, the massaging from those little pads is just the lid. The eyeball does not receive any of that massaging. Okay? All right. So because of that, it's absolutely safe. Now, the other important thing is the amount of pressure that's exerted by those little pads is only about 5 pounds per square inch compared to 30 pounds per square inch if we try to just squeeze those glands dry. Okay? So it's a lot less pressure, but more effective. Other safety in the FDA study, no unexpected side effects, no irritation. There was a small percentage, 2.9%, had a little irritation from the eyepiece, but it went away the next day without any treatment. So it was basically nothing. The other thing they want to know is, what's the level of any discomfort? So from 0 to 10, 10 is severe excruciating pain. During the treatment, patients said their pain level was 1.4, very little. So you feel something, but it's like nothing, right? And then once we finish, we take the eyepiece out, and then they ask the patient, what's your discomfort now? It was 0.2. Okay, so it's essentially a painless treatment. There's no recovery. We take the eyepiece out, and you go on about your day. Okay, there's no downtime. All right. Also, in the study, we had to prove that there was no change in pressure. So if a patient has glaucoma, we don't have to worry that it's going to change their eye pressure. And that makes sense because the massaging is the lid, not the eyeball. But that way we know it's safe even for patients who have glaucoma. Okay? And nobody lost any vision as a result of the treatment. So a very safe procedure. Now, there's another newer version of that called tear care. Tear care is a little different, but it does the same thing. With the tear care, we place these two little, they almost like a little mini band-aids, one on the top lid, one on the bottom lid. And it has a little thing that sticks on your temple, and that like a little adhesive. And those little band-aid looking things have little heating elements in them. So with this, we put it on the lids on each eye, and it warms up like the other one does. But this one, your eyes are open the whole time. In fact, we tell patients to go ahead and blink because that melts the crud, and as you blink, it helps to extract the crud out because it's being melted at the same time. So if a patient is claustrophobic, they don't want to have their eyes closed, or something like that, or if they have a really small eye and that other eyepiece won't fit in there, this is going to work better. Also, one other difference is with this one, we can actually, see if I can get it to go, we can actually go back. So here's another picture of the little things with the little heating elements. After we do that warming, we can actually go in and gently squeeze the lids to get any extra stuff out. So if there's one area in particular that's still a little more clogged, we can go back and work on that little area a little bit more. Okay? So we can kind of more customize the treatment. The studies show that they have equal efficacy. So the results with the with the LipiFlow and with the tear care are generally the same. For each particular patient, the doctor will tell you, hey, you know what? You're better with this treatment versus the other one. But they're going to both help. Okay? All right. Here's another picture again with the little eyepieces. And again, you just sit there. This one's 15 minutes. You just sit there in the warming and blinking. Easy. All right. So the LipiFlow and tear care. So what do we expect from the treatment? Generally, the improvement in the number of glands that are producing tears will improve by 2 to 3 times. Because again, when the glands are clogged, you're not getting tears. So now, when we unclog them, now you have a lot more tears working because the glands are not clogged anymore, right? The improvement usually starts after a week or 2. Patients who've had long-term chronic blockages are going to take longer to get better, right? And even after we do this treatment, you still have to do the maintenance. Patients will say, well, once I do that, can I stop taking the Restasis, or do I have to still do the lid cleaning, or can I stop doing all that stuff? No, you still have to do that. Because these two treatments, the LipiFlow and tear care, is working on the part of the dryness that's from blockages. The other parts of the dryness still have to be addressed. So you still have to do the other stuff, okay? All right. What is the goal of the treatments? Again, to unblock the gland so that when you blink, the tears can flow onto the eye, right? Does it hurt? No. Both of those treatments, all those treatments I showed you are totally painless. I've had them done too, and I can tell you my experience too. Totally painless. How long does the treatment last? So the lipid flow, for example, has been around longer. The studies show that treatment can last you from 3 to 5 years, one treatment, okay? It can be repeated sooner, but in my experience, and we've been doing it now for about 8 years, that's about what we're seeing. Somewhere between 3 to 5 years, patients will generally need another treatment, okay? What's the success rate? The studies show, depending on which study you look at, 85 to 90% of the patients get better. So very, very effective. So it's safe, it's painless, very effective. Okay? All right. Is it safe? Absolutely. We already showed you the FDA studies. Who's a good candidate? So anyone who does not have an active infection and has not had recent eye surgery and shows that they have good gland. Remember I showed you the pictures of the glands? And I showed you some that were scarred over. As long as you don't have severe scarring, they're a good candidate for the treatment. Okay? All right. And we can do it on, this we had in there because we used to have a lot of patients that travel from out of town. We still do. There are patients who will come in just to get treated and then drive back to, El Paso or wherever they're at. And that can be done. All right, and what's the follow-up? Typically, we see patients about a month later after the treatment to see how they're doing. Okay? Can we stop the other treatments? As we said, no, you still got to do the other stuff, right? It's like going to the dentist and they fill your cavity, but you still got to go and brush and floss or you'll be back with another cavity. Okay? Can we do it at all our clinics? So the clinics that are set up to do these treatments is the Hebner Clinic, the Burney Clinic, and the Westover Hills Clinic. Okay? Any of those three, we can do these treatments. Now, in rare cases, even after we've done all this treatment, and we look at the eye and the eye looks perfect, the tears look great, the surface is smooth, everything looks perfect. In rare cases, some patients will say, well, I still feel some discomfort. It still bothers me. That is a rare condition called neurogenic eye pain. Neurogenic eye pain is pain that's actually in the root of the nerve. The best example I can give you is if you've ever known anybody who's had shingles. Okay, you get these awful blisters on your face or your torso, and they're very painful, but they heal. Once they heal, most times your nerves calm back down and you're okay. But in rare cases, you can have ongoing pain and it feels like you still have those blisters, but they're gone. It's just pain in the root of the nerve. Okay? Those are rare. The same thing can happen on the eye. Even after we fix the eye and it looks perfect, they say, well, I still feel something. That's called neurogenic eye pain. And there are treatments for that, what we call NSAID drops, like the one we talked about. The Procura lens, the amniotic membrane can help with that to help to restore normal nerve function. Okay? So that's rare, but I did want to let people know there is something that we can do for that too. Okay? All right. Now, the gentleman asked the question about, is this treatment covered? So most of the stuff that we do to treat dry eyes is covered, but not everything. Same with a lot of stuff. Your medical insurance doesn't cover everything. Your dental insurance doesn't cover everything. Covers most stuff, but not everything, right? So how do we know? So the stuff that's covered by insurance is what's called the standard of care treatment. Standard of care would be, how do most doctors treat that problem? Okay? So most doctors would treat the dry eye with what we have down here, the warm compress, the tears, plugs, and then the Restasis or Xiidra. That's the standard treatment most doctors in the community do to treat dry eyes. Well, as we just covered, there's a whole lot more that can be done. Well, most of these things then are not necessarily going to be covered. Like for example, on this list, the Procura is covered, the Regenerize is not. The Blefex is not covered. LipiFlow Tear Care is not covered. Oxyvate Tyrvaya is covered. So a lot of it's covered, not all of it. Anything that's not covered will be reviewed with the patient before it's done, right? But in general, we try to do what's covered first, but if we're not getting the full result we need, we know there's more that can be done, right? Now, even if something is not covered, patients can still use like a flex spending account, medical savings account. There's companies that finance medical procedures. There's a lot of other options too, right? Now, so again, kind of in summary, what makes your eyes dry? One, again, not making full and complete blinks, right? Number two, if there's damage to the corneal nerves. Number three, if there's inflammation, shutting down the tear production. And number four, if the glands are clogged up, right? So a successful treatment, we're going to have to address all of those things. Making the blinking effective, right? Full frequent blinks, right? Unblocking the glands. The warming helps, but ultimately that BlephX and the lipid flow or tear care is what's going to flush out the crud. Okay? Controlling the inflammation with the medications that we described and the omega-3 supplements. And lastly, if we have to regenerate the corneal nerves, we can use the Regenerize, the Oxervate, Procura, all these things to regenerate the nerves. All of those things have to be addressed. Okay? So how does this work from a flow standpoint? So number one, we hear patients come in for their regular eye exam. That's not a dry eye evaluation. That's where we check them for cataracts and glaucoma, check the vision, that kind of thing. And overall, a regular exam. If we see evidence that something's wrong with the tear film or the glands, then we have the patient come back for what's called a dry eye evaluation. That's where we do the very detailed analysis of the tear film, take pictures of the tear glands, the blinking, measure the tear film, all of that type of thing. Okay? Then we start that treatment. The warming, the omega-3s, the stuff we said. Okay? All right. After we do that warming and blinking, kind of the basics, the next step is we use the medications, the Restasis and Xiidra, or similar medicine to control the inflammation. If there's still dryness, or the surface is still very dry and refusing to heal, then we do these ones that have the growth factors and the stem cells, right? The Procura, the Oxervate, all of these, okay? If we're still not getting results because they're still blocked up, then we do the BlephX, the LipiFlow, the tear care, etc. Okay? So that's kind of the flow on how we approach this. Now, for a particular patient, we may go from step 2 to step 5. I mean, it depends on a case-by-case basis. This is not set in stone. Or patients may come to us and they've already tried these other things, in which case we jump to the next level. Depends on the particular patient. So again, our goal, we'll start this again, is to have that nice full blinks, right? Nice clean eyelids, no crud or infection in the lids, full thorough blinks, and that nice healthy tear film flowing on the surface. Okay? That's what we want. Right. Good. I think that's it, right? Let me see where we're at. Okay. So, any questions here or any questions that came in?
Yes. We can do the online ones real quick.
Okay.
Somebody asked, can taking antibiotics increase dry eyes?
Okay. So, taking the antibiotics does not make your dry eyes worse. Other medications can, but not antibiotics. In fact, they can actually help if there's any infectious component to the inflammation or blockages in the gland, because that's common for the lids to be blocked up and infected.
Another question is, if you're on prescription drops for dry eye and artificial tears in between, are the allergy drops okay to use?
Okay, so the question was, is it okay to use allergy eye drops in addition to the prescription ones? Most of the allergy eye drops that are out there that you buy over the counter are antihistamines. Okay, antihistamines make your eye more dry. So the antihistamine drop, excuse me, can help with the itching and mucus from allergies, but the secondary side effect is it makes your eye more dry. Now, so I tell patients if your eyes are severely itchy and they're just driving you crazy, okay, you can put the allergy eye drop in, you'll get relief from the itching, but your eye's going to be more dry the rest of the day. So you have to make up for it by using lots and lots and lots of tear drops. Now, there's a prescription allergy eye drop called Alrex. It's made specifically for allergies. It's a mild steroid. That does not cause secondary dryness. In fact, it helps the dryness because it's a steroid. It reduces the inflammation. That's by prescription only. Okay, so that would be another way to treat the dryness. Excuse me, the allergies.
And then
Yeah.
one more question.
One more question.
When using a heated eye mask for 10 minutes, is it normal to have blurry vision for a few minutes after?
Sure. So the question was, after you do the warming mask and you remove it, is it common to see blurry? Absolutely. Yeah, you definitely will. That goes away, but it's just very transient. Yeah. Okay. Yes, ma'am. There's a question here.
I had recently read that there's a laser treatment available, I guess just more recently, for dry eyes.
Yeah. So, yeah, it's not really a laser. There is one called IPL. IPL, it stands for intense pulse light. And people think of it as a laser, but it's really not technically a laser because it's not ablating tissue. But what it does is it puts real deep, intense warming underneath the skin into those vessels. And the study showed that it can be effective for dry eyes, but you still have to do the gland expression. You still have to go back and squeeze the glands. Okay?
Do you do the IPL here?
No, we don't. There is a doctor in town I've had referred a couple patients to. I've had IPL on my face for rosacea. I have a very mild rosacea. I will tell you, it's uncomfortable. IPL is not for the faint of heart. It can be beneficial. It originally was made for rosacea, and it does work. It basically ablates, you know, it evaporates those blood vessels under the skin that cause the redness and flushing. And there's debate whether it's really safe to do it that close to the eye when there's other stuff that we know is totally safe. So I would recommend the safe that we know is safe before other stuff. Yeah. Yes, sir. Did you have a question?
Yeah, I have a question. Mine is usually, has been for 10, 12 years this eye. And I always feel, if I'm laying back, like watching television, something like that, I always feel like there's something foreign in there. Just
Yeah.
like when you get a speck of dirt or something like that all the time. As soon as I sit up, it goes away.
Goes away. Yeah.
And if I use artificial tears, or I use that and I use the gel,
Mm-hmm.
and it works for a while.
Yeah.
But it always feels like there's something. I don't know if the eyelid is at a certain position.
Yeah. So yeah, the tissue on your eye is the tissue on the eye and on the lids is very loose. You know, that's why, like, you see somebody gets a black eye, it swells up really big. The tissue is very loose.
Something on that, because about another 5 years ago, I saw another doctor, an ophthalmologist, remove my cataracts, and I told him about that, and he said there was some growth. I don't know, skin tags or something underneath the eyelid, or
Yeah.
and he removed them, but it didn't do anything. But it doesn't bother
Not
me
all the
at
time.
if I'm sitting
So,
up or standing or walking.
yeah, for the folks that are watching at home, the gentleman was asking about that he says that he feels what we call a foreign body sensation, but only when he's laying back. When he gets up, it basically goes away.
Yeah.
So, yeah, we can look at that. You know, sometimes you'll have a really bad dry spot. Sometimes you'll have really lax lids, and the tissue on the eye is so loose it kind of bunches up. Kind of like the skin on your body, it kind of bunch up if you bend over, you know. So different stuff is going on, so we have to look at it.
I have an appointment with you, I think this month or next month. Do you tell us which would be the best treatment, and whether it's covered
Right.
by insurance or not,
Right.
or if it's...
Yes. So he was asking about, he's got a follow-up schedule, and you know, when will we say this is what we recommend. So I showed you that flow chart, and probably that looks familiar. This gentleman is one of my patients, so you know, depending on, we start one treatment, give it some time, evaluate, see how the patient's doing. If they're not doing well enough, we go to the next step. If not going up, we go to the next step. But anything that's not covered by insurance, we tell a patient beforehand. There's no unpleasant surprises. Yeah. Okay. All right. Any other questions? Yes. One more.
Question. Does high doses of niacin B3 cause dry eye?
You know, there was a study that showed that. A lot of these are hard to really say if they're valid because, you know, are the doses that are being given closely regulated, and are they controlled? And is it well, like I said earlier, a mass study? In other words, if the patient knows they're taking this supplement and they're going to say, my dry eyes got better or got worse, it's hard to know. They'd have to be on a placebo, some on a placebo and some on this supplement to really know. And the doctor that's evaluating them shouldn't know either if they're on the placebo or on the supplement. So there was a study that showed there was a possible association, but that doesn't mean that's what caused it. So I wouldn't change a supplement just based on something like that. Yes. Okay. Any other questions? Okay. So the people who are online, who have commented or asked questions or shared or liked it, are automatically registered for a drawing to get one eye treated free with these other treatments we talked about. And Justine is going to get the names of the folks who are here today. So that way, tomorrow morning, I believe you're going to do it, Justine, and then you'll notify whoever it is. Okay. Right. That way, everybody has an equal chance. So, all right. So for the folks who are here, this will be on our Facebook page, and in another week or two, it'll be on our website. You can go back and look at it again. We encourage you to review it. There's stuff you missed. You want to go back and make notes, share it with friends or family. The more people that get this information, the better. Okay. We'll be doing these probably once a quarter. The last one we did was in August, so we'll probably do another one around February, maybe March. And there's always new stuff coming. I mean, the one I did in August is already outdated compared to what we did tonight. Okay? Yes. Okay, that's it. We cut off? Yeah.
Is the appointment, like the dates in the future, are they on the website?
No, we haven't. Literally what we do is when we finish one seminar, the next day, Justine and I will get together and say, okay, let's plan the next one. And then we'll put the next one on the website. So we haven't even talked yet. Yeah. But yeah, we do. That way we have plenty of time to plan it. Yeah. Okay, doke. We're done? Okay, doke. Okay, does anybody want to try this nose spray? I just opened the box, so